Welcome back to the program. It's still Daybreak Africa, and we're reaching you from the Lagos studios of KAFTAN Television. Now, according to the United Nations data from 1990 to 2019, the global fertility rate fell from 3.2 to 2.5 lives birth per woman. Today, close to half of the world's population lives in a country where lifetime fertility is below 2.1 live births per woman. The decline in fertility ranged from 1.9 births per woman in Central and Southern Asia to 0.1 birth per woman in Australia and New Zealand, Europe and Northern America, and in Sub-Saharan Africa, the region with the highest fertility levels, the total fertility rate dropped from 6.3 to 4.6 births per woman. Now, this has become a societal issue that a lot of women have tried maybe native ways or medical ways to fight the battle. It has caused a lot of people to lose their homes, their family, and probably lose their self-esteem. Now, one may want to wonder that how is it that up until 2023 we still have this in our society? This morning we're going to be talking about infertility, its causes, treatments, and alternative measures. And joining us to discuss this morning is Dr. Koyenikan. Good morning, doctor.
Good morning.
Thank you so much for joining us. Thank you. Thank you so much for joining us. Now, let's move straight to the topic, which is infertility. Now, I've done quite a little research on infertility, and while it may be natural, research says that there are causes that are artificial, that are man-made, that could lead to infertility. Could you please tell us about this?
Okay, so before I go to the causes of infertility, I would like to first define it slightly.
Okay, please do that.
Infertility actually is, which would actually lead us to the causes of infertility.
Okay.
So now, by way of definition, infertility is the inability of a couple of reproductive age, that is a couple that is matured enough to give birth.
Okay.
So that is using the layman language, the inability of the couple to achieve pregnancy after 12 months of regular, adequate, and unprotected sexual intercourse. So,
wow.
Firstly, what is meant by when we say adequate sexual intercourse, we mean a couple that is having sex about nothing less than 3 times in a week on different days.
Okay.
So, and also the sexual intercourse must be protected. That means they must not be using any protection. They must not be using condom. You can't be using protection and expect to get pregnant.
Okay.
Okay, so now to answer your causes of infertility, contrary to popular opinion in this part of the world, the causes of infertility can actually be from either the man, the woman, and sometimes it can even be from both of them. So, and then we have, and it's important to say this because in this part of the world, in Africa in general, in Africa especially, it is believed once a couple is unable to, get pregnant, it is believed that the woman is actually the cause, and that is not true according to research. It has been found that research that men and women actually have equal, when we are looking for what I mean by, they actually have equal prevalence when it comes to causes of infertility. For example, we would say that the female factor would account for 30 to 40% of causes of infertility. The male factor also accounts for 30 to 40% of infertility. Wow. And then just about 15 to 20% of infertility is caused by a combined factor, that's combined male and female factor. And then very little population, we have about unexplained causes of infertility. That's about 1 to 5% of infertility, is usually unexplained, and that's when we say infertility is unexplained, is when we carried out all investigations and cannot pinpoint, the cause of this infertility. So for the male factor, I will start with that.
Okay.
Since that is not so popularly talked about in this part of the world.
Right.
So there are so many that can cause infertility in men. One, it could be caused by undescended testes. You know, there are some children that when they are giving birth to, their testes don't descend. They stay in the abdomen, and that's in the tummy. So they stay in the abdomen, and you know, I think there's more awareness concerning that now, but you know, in the past it was not something that people didn't really check the scrotum of babies, and even when they check, and they just feel it's not something to be worried about.
Yes.
When you have undescended testes, and when it is both testes and stays in the abdomen like that, and they don't seek for help time, it can cause infertility. Also, there's this popular, I think the Yorubas call it shigidi, that's monks.
Okay.
So, and also it's a childhood illness where the side of the face is swollen, and it can also cause infertility. And that's why it's important that when you notice that kind of problem of male child, you actually report to the hospital or home. Infertility can also be caused in men by testicular torsion, and this usually presents as sudden sharp pain in the testes, in the scrotal area. So when you see an adult or a male, a man or even a child, a male child, that suddenly starts screaming that his private part is paining, that his scrotum is paining, it's very important to go to the hospital, because most times what we do is we care it surgically in order to prevent because if it's not repaired immediately, it can affect the testes and also cause infertility in the future. Also, smoking, lifestyle like smoking, and pesticides, lead, radiation. So people that work in lead industry and people that are usually persistently exposed to radiation, or even cancer patients that have to go through radiation, it will also be as a result of that. It will also be caused by hormonal imbalances like hyperprolactinemia. So when you see a man that is having nipple discharge, milk coming out from the nipple of the man, that's a strong indication for hyperprolactinemia, and that man is supposed to be hospital to get checked. Also, some infection like gonorrhea, if not properly treated, can cause infertility, as well as also varicose vein also can cause infertility. So now we'll talk about the female factor.
Doctor, before can you hear me, doctor?
The problem with the fallopian tube, and fallopian tube is where fertilization actually takes place. So when that is blocked, obviously fertilization will not occur and there will be no pregnancy. And some of the things that can cause tubal blockage include pelvic inflammatory disease, and that is well, I would call it, let's just say it's caused by infection, persistent infection most times. And that's why when women should always learn to visit their gynecologist whenever they have vaginal discharge, any abnormal vaginal discharge, or even urinary tract infection. You know, it's really better to go to your gynecologist so that we can properly investigate and give you the right medications for it. So you don't just do self-prescription and then end up with pelvic inflammatory disease, which can cause tubal blockage. Also, endometriosis and additions, and these conditions can be seen of women that suffer from endometriosis. And that's most times women that suffer with endometriosis can come down with severe pain, menstruation, and stuff like that. Okay, so we also have some ovarian causes when there's a problem with the ovary. Okay, so one thing that can affect the ovaries will be menopause. Obviously, when a woman gets to menopause, and some people believe that you need to get the age of 50 before you attain menopause. Sometimes some women attain menopause at the age of 5 years. it's called premature menopause. Let me put it that way. So when menopause is premature ovarian failure, rather. So that's when a woman stops menstruating before the age of 45 years.
Wow.
So obviously, and when there's no menstruation is one of the indications.
Yes, that you're fragile.
Or ovulation. And when there's no ovulation, obviously there's no egg, so there will be no fertilization. Also, polycystic ovarian syndrome. So, and usually presents as irregular menstruation. So, and that also is treated by gynecologists. We also have some, some hormonal imbalances to like hyperprolactinemia, to female hypothyroidism, and also exposure to radiation and chemotherapy, cancer patients, and all that.
Okay.
And it could also be a problem with the uterus itself. So I'm sure a lot of us are popular with what is called fibroid. Yes,
right.
Fibroid is one of the causes of infertility, and most times, first I would just like to say that most African women actually have fibroid. It is not something that is bad. So it is just there. Sometimes it might be asymptomatic, it might not cause any problem, it might not affect, but sometimes it can grow so big and then disrupt the uterus, and so there's no place for the embryo, for the baby to stay. So then just like there's no place for the baby to stay, and then of course it causes infertility that way. So,
thank you so much,
thank
Doctor.
you.
Thank you so much, Doctor. That was really enlightening. Like she put everything together in just how many minutes? And
but before we go on, before you go on, you mentioned something earlier about the male fertility and all of that, and you said something about descending testes. So how does a parent identify the undescended testes in the child? Because I have been able to, I've seen some children, particularly male, that by the time you touch the testes, you feel like, is it the X now or something? Like it feel kind of a bit hard, just a bit hard. And then I've seen another child that that side is just it's just so soft, like it just feels like there is nothing there. Yes. Wow. I intend to wonder that I hope
what's going on
is
here?
Really okay. How can a parent identify the
I think first of all, what she said now, does it mean anything medically? And does it lead to the identification of the testes that you mentioned earlier?
You said what? I didn't get that last part. The
example she gave now, does it mean anything medically? Could it be a symptom of something, of a medical condition? And does it have anything to do with the testes checking that you mentioned when it comes to children?
Okay. Yeah, so like she said, it was that lower part that is just below the back of the penis, that looks like a bag. That's what we call the scrotum.
Yes.
So the testis is the scrotum is supposed to house testes. So like so when you touch and when the mother touches because I don't advocate for strangers. In fact, strangers touching other people's brain.
Absolutely.
In that way, quite inappropriate. So when a mother or a father have children, their male children, and they check the scrotum, they are supposed to feel something a bit not so hard, but they're supposed to feel something there. So in a case where there's nothing there and it's just that scrotum that is there, and most times it usually happens in one side. You notice that the second side it might be there. So it might be a symptom of that undescended testis. So to confirm that, the best thing is to take that when there's a worrying symptom like that, the best thing is to take that child to the hospital so that the doctor can check and actually make a diagnosis. The doctors are more experienced, and we've seen a lot, and we can actually identify it better.
Right.
But that can be a warning sign that the testes might be undescended. So the best thing to do would be to go to the hospital, to present to the hospital, and let that child get checked by a specialist.
Thank you so much, Doctor. While you were defining infertility, I heard a lot of new things anyway, including the 12-month period and all of that. But what I want you to expatiate a little bit on is managing infertility itself, because I know there's the emotional part, there's the medical part, and all of that. What can we do to manage this situation? Because usually, especially for us in Africa, there's this pressure that comes from people, maybe those around you, your family members, and all of that. Even yourself as a woman, I know that in most cases, waiting for that 2 weeks after ovulation just to check that, okay, will the period be late, can be depressing. It's a very long time that can cause it seems as if 2 weeks becomes like maybe 6 months in your eyes, and can make one even depressed, and you start wondering what's going on in my body. And then when the period comes, you're disappointed again. How do we manage infertility, and what are the treatments to some of these causes that you've mentioned?
Okay, so like if you remember clearly my definition, I said when I was defining infertility, I said it's the inability of a couple. I didn't say the inability of a woman.
Of a woman,
so
right.
The first thing to do in the management of infertility, like I'm purposely emphasizing this because I know in this part of this country we are so fixed on the fact that the problem
even the pastors will say barren women should come outside. They will pray for only the wife and leave the husband.
Exactly. So when you want to face a problem like this, when you want to when we are talking about the management of infertility, both the
Well, she was talking about managing infertility, and I think the first part that surprised me was the definition when she said a couple who have been trying to
they
make
usually
babies.
say it.
And it's not just having sex; it's about having sex for like maybe three times a week, and then you've been trying for at least 12 months. Yeah, because a lot of people will try for 2 months, and there's already this pressure.
I've seen
what
so
are
many
you
doctors
doing and all of that?
who send their patients back. I know. Until you try for a year. Don't come back here.
Don't come back here. Really?
Don't come back until you try for a year. That's when we can define
That's a new one. Let's go on a break now. When we return, our guests will continue to talk to us about infertility. Do stay with us. All right, welcome back to the program. It's still Daybreak Africa, and we still have Dr. Koyenikan with us talking about infertility. Before we went on the break, she was trying to explain how to manage infertility, and she was able to highlight the importance that it concerns both the man and the woman. Doctor, please proceed.
Okay, so like I was saying, so when we want to manage infertility, we usually advise that both the male and female partner should actually present to the hospital. So a gynecologist or a fertility specialist, those are people that deal with infertility. So usually what they do is they run some investigations that might include the semen analysis for the man, just to check the quality of the sperm cells and to know if the problem is the male factor. They would also investigate the woman by checking her tubes. We do some investigations called the hysterosalpingography, popularly known as HSG. But also do some scans to check for the uterus to know if there's any fibroid that can cause that is big enough to cause, or maybe the positioning, if it can cause infertility. We also run some hormonal profile. Basically, what they do is just to investigate those causes, which we discussed earlier. So the whatever they find from the investigation results will now determine the next step in the management, in the treatment of the infertility. So I'm lucky enough for us. There are so many innovations now in medicine. Before it used to be an hopeless case for so many people. Right. But now there are so many, there's hope now, so to say. There are so many innovations in medicine. There's, the assisted reproductive technology that includes, the popular ones that we all know, the IVF, in vitro fertilization. There could also be artificial insemination. If there's a problem with sperm, also be by, sperm donor, using a donor sperm, a donor egg, And there are so many things. And in some cases, it might just be that they might give some medications, to stimulate egg production if the problem is with the eggs. Also, if the problem is with fibroid, they might have to remove the fibroid and do some what is it called? Surgeries. They might do a surgery called the myomectomy.
Okay.
So in all of this, the best we can't really say there's a particular treatment to infertility. There's no one treatment. Treatments will depend on the results of the tests done, the investigations done. So that will not determine the kind of treatment that will be carried out. So after your gynecologist has seen you, they will then discuss the appropriate management. I would just like to say that for couples trying to give birth, I know we are in a very spiritual society and we love to pray. And as a Christian myself, I don't have anything against prayer. But what our advice is, there's nothing stopping you, as no matter how religious you are, there's nothing stopping you from also seeking medical help and seeking it very early. So once you start trying within 1 year and you're not able to, just present to the hospital. The earlier the better, because as women, grow older, the ovarian reserve actually reduces. So sometimes it might just be that the problem might be a male factor, might be from the male partner. And then you just keep trying for 5 years, 10 years. So by the time you come, you are now 45, 50, ovarian reserve has already gone down. That becomes a double problem. You get a double issue now. So it's better you just know once it's 1 year and there's nothing, you're not getting pregnant. Just come to your gynecologist, or fertility specialist, let them investigate you. And also, I know the world is changing now. It's a global world, and a lot of women are becoming more inclined in pursuing their career, and I really love that for women. But I would like to advise that if you are a career woman and you don't want to, and you are a career woman that would like to have children later on in life, it will be better. And that like later on in life, it will be better if you freeze your eggs, so that by the time you've achieved all your goals, you can always come back to that, because we have a biological clock. So that's
thank you so much.
One last question, doctor. Now you just talked about treatment and managing and seeking help and all of that. Now let's take you back to the fibroid issue. Now we've seen so many women that who have fibroid, and is also a cause of infertility for them. And we've seen some of them who have shown by treating their fibroids with taking it the herbal way. You get having to take concussions and all of that. They've testified to it that yes, it has really worked. Now, as a doctor, as a medical doctor, now do you subscribe to taking herbal drinks or going the traditional way for treatment of fibroids?
Definitely not. I do not subscribe to that. In fact, I believe that those it's not just a belief. I know that those herbal drinks rather, they cause more harm than good. So many some of them affect the kidneys, and even sometimes this fibroid. I've seen cases where women go to meet this, to take herbal concussion, and sometimes they give them some things that they insert into their vagina, and what it does is they start bleeding and bringing out something that they think is a fibroid that is coming out, but it's really not the fibroid. By the time they come back, they are coming back with there's something we call stenosis. They are coming back with stenosis. The cervix becomes so close that nothing can go inside. So that's like another problem on its own, which can even.
I think we lost the doctor right there, but more importantly, she has answered the question, which is that she's outrightly against it.
Because there are so many people who have some that, no,
it's definitely not a way to go. It's something that I've experienced, not myself, but I've seen it with someone very, very close to me. She took about concussions. And the thing about those things is that it seems as if it's working. It's probably shrinking the fibroid or something. And next thing you just know, it just goes poof, and the thing comes back again, and it's worse than it was before. So the best bet is to just trust medical professionals and let them handle it. Besides, most of these concussions, there's no gauge. There's no, there's no, what's it called? Prescription. That, okay, this is how you're going to use it.
Take 5 meals today, take 10 meals today.
I'm even sure many of these, let's say herbalists, do we call them herbalists now, or concoction makers? They don't even know the contents, the kind of chemicals that are inside what they're making. They just feel like, okay, it worked for so person, then they just go for the same thing. Well, I don't think it should be so.
I think I just like the fact that our doctor was able to make it clear.
Cover almost all the grounds in
and she also made it clear that it is not a woman problem.
Yes, it is both genders.
Gender
and
issue.
It's for everybody to take note. Then don't rush. Wait for 12 months before you know. I know a lot of people that 1 month into the wedding, they're like, Olu, I'm waiting there. What's going on in
and I think
marriage?
we need to use this opportunity to also tell our womb watchers that please leave
let
TTC mothers alone.
Let the newlywed breathe.
Yes, let them breathe. Yeah.
Let
if you
the
see that someone is trying
breathe.
to conceive, don't come and ask.
They're making effort.
Exactly.
They're not stupid. They know. They know they want to have children. And what if they don't even want to have? What is your Please, let's rest. All right, that's how far we can go on today's episode of Daybreak Africa. Thanks to our doctor for joining us. We see you guys again tomorrow, same time, same station. Of course, you'll be having Fumi and Grace on the show tomorrow. But do keep it a date with us on Daybreak Africa. My name is Rachael Abioye.
And I am Ololade. Okay. Thank you for watching and bye for now.